Hello and welcome to this podcast concerning self-directed support. My name's Adam Coldwells. I'm the Chief Officer of Aberdeenshire's Health and Social Care Partnership, and thank you very much for listening to this. We're about to start on the Self-Directed Support Week. That happens between the 13th and 17th of June and is what we've been calling the Big Blether, all about self-directed support. I hope you get lots from this week. I wanted to start off just reminding you about the vision that we have for Aberdeenshire's Health and Social Care Partnership. There's 5 really key components to our vision. The first is that we start from an asset base. We build on the abilities of the people that we work with. The second is that we deliver things at a really high quality. The third thing is that we're person-centred. We put Mrs. Smith at the very centre of what we do, and we build our teams and our activity around Mrs. Smith. The fourth thing is that we keep and support people to be as independent as they possibly can be. And finally, we want to achieve supporting people to live as close to their own home as they possibly can. So those 5 key things build our vision. Self-directed support is incredibly closely linked to all of the aspects of our vision. Self-directed support is all about putting Mrs. Smith in control of her own future, her care needs, and what we can do together with her. It builds on her assets, what she can do and what she's able to do. It's done well, delivers a very high quality provision. It's very much person-centred. It has Mr. or Mrs. Smith at the very middle of what we do. It enables people to live and support their independence to the highest possible level. And obviously, if that's successful, then more often than not, people will be in or very close to their own community and gather all the strength that they can from being within that normal environment that they've lived and worked in for all of their lives. So SDS sits incredibly well with our vision. When we started on SDS a number of years ago, I appreciate the huge amount of work that all of our staff have done to move in the direction of the self-directed support system. And I would like to genuinely thank you for all of the work that you've done, every single person who's been involved in working in this new and revised way. I know that self-directed support is really great for social work. It absolutely builds on the values of social work. And so, as a professional, it doesn't change your practice much, but I appreciate that the work and the approach we do all around it has been a huge change. And for that, thank you very much. We've still more to do though, and we've got a programme board trying to take forward how we do SDS to try and simplify it for practitioners and for the public that we use and work SDS alongside. Obviously, when someone starts off on an SDS pathway, then we can get some help. We have some work with Cornerstone, and they provide all sorts of support and help for the people who are going to be using the SDS pathway. So remember, go to Cornerstone, direct your clients towards Cornerstone, and they will provide all sorts of help. Finally, during this week, the Big Blether, all around self-directed support, then you can find all sorts of resources that will help both you share the self-directed support with your colleagues and people around you, but also things you can direct the people that we work with, the clients, to some of the material. And when I finish speaking in a moment, that will appear on the screen and give you some of the links that you can follow to find out more information about what's happening this week. Thank you very much for listening, and I look forward to seeing you all very soon. Goodbye.